Welcome to LA County Close-Up. We're here to bring you up to date on how the county is responding to the COVID-19 crisis. Here's the latest news and information.
First, we need to ensure that we remember those that perished, the 1.5 million that perished in the Armenian genocide. As a result, every year the Los Angeles County Board of Supervisors declares April as Armenian History Month. Instead of skipping this commemoration altogether, the Armenian community launched a fundraiser. To honor the lives lost in the genocide, they set a goal to provide 1.5 million meals to Americans in need. They far surpassed this benchmark and have raised enough to buy 3.3 million meals. May we all find ways to give back to our communities that are meaningful and personal. I know in many other ways, this time has been marked by a loss of stability and routine. Our residents have made immeasurable sacrifices personally, emotionally, and financially. Every one of us is eager to ease safer at home restrictions so we can return to a normal life. I'm immensely proud of our residents for adhering to these guidelines so far, which has successfully prevented a huge surge in cases. I'm grateful for the opportunity to share that we are developing a plan to slowly ease restrictions under the condition of some important prerequisites. This will not happen all at once, but in stages when our public health experts deem it appropriate and safe. We don't want to undo all the good we've done and accomplished so far. We are not yet on the other side of this pandemic, and we don't want to prematurely ease restrictions that could overwhelm our hospitals and unnecessarily put lives at risk. We've set 4 key benchmarks that will have to be achieved before we can begin to lift restrictions. Needs of people who are sick and those who have standard health care needs. The modeling conducted by the Department of Health Services indicates that we currently have the capacity, but we must protect our resources to sustain our ongoing needs. This includes adequate staffing, testing, ventilators, and other medical supplies to handle routine care and prepare for any increases. Second, we have to make sure we have protections for people who are especially vulnerable. These are people who have underlying health conditions, are elderly, are experiencing homelessness, live in institutional settings, or don't have access to services. This is the same. Third, we must have the capacity to test, isolate, and quarantine people and have surveillance to prevent further spread. Fourth, and finally, we have to maintain physical distancing and infection control. It will be the county's role to provide businesses with educational materials and guidance to make this possible and to enforce compliance. Ultimately, we want to make sure that as many people return to work as safely and as quickly as possible. If we meet the guidelines I shared, we can prevent or limit the spread of COVID-19 when we loosen physical distancing measures. Until then, I thank you for your patience and your compliance. Your commitment to your health and the well-being of your family and neighbors has gotten us this far. It is in this same dedication that will help us rebuild LA County stronger than before. Now with that, I'd like to introduce Dr. Barbara Ferrer, our Director of Public Health, who will give you the numbers for today. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and to the entire Board of Supervisors. I feel very fortunate to work under your leadership, Supervisor, and I know I've benefited enormously from your strength and from your vision. To update you on our current status, I'm sad to report an additional 52 deaths today from COVID-19. 43 of these people who died are over the age of 65. And 34 people over the age of 65 who passed away had underlying health conditions. 7 people who died are between the ages of 41 and 65, and all of these people had underlying health conditions. The one person who passed away, who was between the ages of 18 and 40, also had underlying health conditions. We don't have this information for the one case that's being reported today by the city of Pasadena. This does bring the total number of deaths to 848 for the entire county. One death previously reported was found to be from another jurisdiction. 91% of all of the people who have died in LA County from COVID-19 did have underlying health conditions. This demonstrates the need for people who have serious health conditions to remain at home, avoid close contact with other people as much as is possible, and at the very first sign of illness, we ask that you contact your provider. If you don't have a healthcare provider, please call 211 and they can make sure that you're connected with a provider in your community. For the 771 people who have passed away, where we have information on their race and ethnicity, 15% who died were African American, 18% were Asian, 1% are Native Hawaiian and Pacific Islander, 37% are Latinx, 28% are white, and 1% identified with another race or ethnicity. To those of you who are grieving the loss of a loved one from COVID-19, we're really completely sorry for your loss, and we wish you and your family peace. We're reporting today 1,035 new cases, and this brings the total number of cases in LA County to 18,517. These cases include 518 cases that were reported by our partners in the city of Long Beach and 293 cases reported by the city of Pasadena. I'm also reporting 100 confirmed cases amongst people experiencing homelessness. This includes 55 people who were sheltered and now are appropriately isolated and their close contacts are quarantined. The vast majority of people who tested positive who are sheltered were residing at the Union Rescue Mission, and we continue to work with the mission to both make sure that folks are isolating and quarantining, but also to conduct additional testing of both employees and guests. We are conducting an additional 7 investigations at shelters, and here we identify both residents and staff who need testing, isolation, and quarantine. 4,211 people who were positive for COVID-19 have at some point during their illness needed to be hospitalized. This is 23% of all positive cases. Currently, there's 1,858 people who are positive for COVID-19 that are in the hospital. 30% of these people are in the ICU, and 19% are on ventilators. These numbers have remained very stable over the last few weeks. So although we've seen an increase in the number of cases, the percent of people that needed to be hospitalized and the percent of people in the ICUs and using ventilators has remained fairly stable for the last few weeks. We're currently conducting 293 institutional, we're currently investigating 293 institutional settings where there's at least one confirmed case of COVID-19. This is 7 additional investigations since yesterday. These include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in institutional settings has now risen to 5,339 people. This includes 3,847 residents and 1,492 staff. The large increase in the number of residents is because we have done a lot of testing in our facilities, and because of the increased testing, we've been able to identify many asymptomatic residents and staff who are positive for COVID-19. I am sad to report that 365 residents who lived in these institutional settings died from COVID-19, and this now represents 43% of all of our deaths across LA County. The majority of people who passed away did reside in our skilled nursing facilities. As part of our ongoing efforts to ensure the safety of employees and residents at skilled nursing facilities, we are announcing today that Dr. Davis will be issuing a new health officer order for all licensed congregate healthcare facilities. The order includes measures intended to reduce the transmission of COVID-19 at these facilities and to protect vulnerable residents as well as all of the employees. The order will require facilities to limit the entry to the facilities to only those people who need to work at the facility. This means that non-essential visitors and workers cannot come into any of the congregate living facilities. It suspends all communal dining and communal activities to make sure that there's ample distancing among the residents who reside there. Staff will be required to always wear surgical masks and to use personal protective equipment when it's appropriate. And residents will also need to wear surgical masks or cloth face coverings when they're outside of their personal room. The facilities will be required to follow all of the recommended infection control guidelines, both from the federal government, the state government, and the local government here, our public health guidance. The facilities are also, and this is new, they are required to conduct COVID-19 testing for asymptomatic and symptomatic residents and staff, and they will be working with the Department of Public Health to determine the frequency of that testing. I want to mention that beginning on Monday, in coordination with LA City and with assistance from the Department of Health Services, we will begin this process to make sure that we're able to test all of the residents and staff that reside in our skilled nursing homes. As we start this testing, facilities with the most severe outbreaks will be prioritized, but we will in fact make sure that there's testing available in every single skilled nursing facility in the county of LA. I'm also reporting 115 confirmed cases at some point in time at our jail facilities. 47 were among people who are incarcerated and 69 were among staff. The Sheriff's Office is reporting that today in their facilities, there are 28 inmates who are positive, 19 people who are incarcerated that have recovered, and 92 people who are incarcerated that are in isolation. 2,240 people who are incarcerated in the jails are currently quarantined. There are 93 cases in the state prison. 77 are among people who are incarcerated, and 16 are among staff. And there are 85 cases in the federal prison facilities. 82 of these are among people who are incarcerated, and 3 are among staff. 11 staff working in our juvenile facilities have also tested positive for COVID-19. We do post every day information by facility that includes the number of positive and suspect cases, as well as now, hopefully starting today, the number of people who have died amongst the residents and the staff. And you can see an updated report of all of our LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The Los Angeles County Sheriff Department today is reporting 61 positive cases among staff. 295 staff are still quarantined, and 612 staff have returned to work. The LA County Fire Department will be updating their numbers later today. And I want to thank Sheriff Villanueva and Chief Osby for tracking and reporting this data. There's over 108,000 people who have been tested and had their results reported to LA County Public Health Department, and 15% of people tested for COVID-19 have been positive. And I want to continue to encourage people who have symptoms to please get tested, and to note that this test only takes a few minutes. The information is confidential. It'll be released only to you and to your provider if you've designated a provider. The tests only take a few minutes, and appointments are available at almost all of the regional testing sites. So you can find the testing sites and make an appointment online at covid19.lacounty.gov/testing. In closing, Ramadan has begun, and I want to wish a happy Ramadan to our Muslim friends and neighbors who are observing. This is a time when people want to be with their faith community, their friends, and their extended families. Because it's really important to continue to follow the safer at home order, this prohibits gatherings of any kind. So we're asking you to please observe this month with the people in your household and connect to your faith community, your friends, and your extended family from afar, online, by phone, and using all the other ways technology is allowing us to stay in touch. I wish all of you in LA County a safe weekend. Thank you so much for what you're doing to slow the spread of COVID-19. And now I'm going to introduce Kevin McGowan, the Director of Emergency Management.
Good afternoon. Thank you, Dr. Ferrer. Kevin McGowan, the Director of the Office of Emergency Management and also the county's Emergency Operations Center. I wanted to share a few remarks today about our cooling centers. So as warm weather continues to arrive in Los Angeles County and we transition into summertime, we know that there's at-risk populations who might not have access to air-conditioned environments, and they might need some. So the county, in conjunction with our city partners, have activated about 10 cooling centers that are spaced throughout our county to provide emergency assistance if people can't have access to cooling. The emergency cooling centers are currently in operation starting today at 12 and going till 6 p.m. tonight, and then also tomorrow from 12 to 6. And we'll continue to reassess the need for cooling centers in the future based on the weather conditions. Our cooling centers are operated utilizing social distancing and safety practices that would be important for this pandemic. Information related to the cooling centers can be found on ready.lacounty.gov. That's ready.lacounty.gov. Or you can go to any of our county websites and access the information that's needed to find the closest cooling center to your location.
For more information, go to the website on your screen.